Type 2 diabetes reversed with low-carb diet. You know, whenever you see stuff like this, it's helpful to start saying, okay, well, how do they define each of these things? How did they define type 2 diabetes? How did they define reversed? And then how did they define low carb? And how did they define diet? So these are all questions to be thinking about as we go through the details. So people with type 2 diabetes have a low tolerance to carbohydrates. Well, you would think, but again, you get into some of the folks that are just uber plant-based, they say it's really all fat that causes the problem. I don't agree with that, but we'll get to that a little bit later. That's one of our discussion points. Eating excess carbs increases blood sugar levels. It eventually requires people to take insulin or diabetes medication. According to Mark Cucuzzella, a professor at the West Virginia University School of Medicine, has published several studies on dietary changes in diabetes. Their bodies do not metabolize and respond well to carbohydrates. Well, that's the truth. And the end result is high insulin levels and hyperglycemia, or high blood sugar levels. Yes, that's true as well. And either of those things, high insulin levels or high glucose levels, can cause inflammation, which in turn causes a burn of the lining of the artery wall. That burn of the lining of the artery wall causes cholesterol, at whatever level your cholesterol happens to be, to seep through that lining. It won't go through the next layer, the media or muscle layer, so it gets stuck. It gets stuck between the intima layer, the lining, and the muscle layer, the media layer. That's why we look at CIMT, the carotid intima media thickness test. You're measuring the amount of plaque in those two layers. However, restricting carb intake type 2 diabetes is a controversial topic, believe it or not, largely because trial results have so far been pretty inconclusive. Now, that's an interesting question, which we can discuss again later if there's an appetite to do so. So here's a couple of the articles. One is BMJ, again, one of the major medical journals in the world. You can criticize it just like you can criticize any of them. But here are the two topics: efficacy and safety of low and very low carbohydrate diets for type 2 diabetes remission. Systematic review, meta-analysis. Now, one thing I'll stop and say, remember, meta-analysis is not just one clinical trial. It's a study of all the other clinical trials and studies that have been done and published. Meta-analysis of published and unpublished randomized clinical trials. The other one is nutrition therapy for adults with diabetes or prediabetes, a consensus report from diabetes journals. To better understand the impact of a low-carb diet, researchers that published in this BMJ article analyzed the data from 23 trials that involved 1,357 patients with type 2 diabetes. The new meta-analysis was published in BMJ. Researchers found that type 2 diabetics who followed a low-carb diet for at least 6 months experienced greater risks of remission than those who did not. I'm going to stop and make an editorial comment. If you read, Jenny Ruhl, R-U-H-L, runs an award-winning site for diabetics. It's called Blood Sugar 101. She wrote a book called Blood Sugar 101. You can learn an immense amount just reading the first 60 pages. Depending on how quickly you read, spend about an hour with that book. You learn a lot about prediabetes. She wrote another book. It was called Diet 101. And in that book, she had a couple of key things to say. One of them is eat to the glucometer. And if you're eating to the glucometer, which James has become a passionate supporter of, if you're eating to the glucometer, you're not going to have many arguments about eating a low carb versus high carb diet. The other thing that she brings up, which is a critical point in Diet 101, is it's not a diet. It's not 6 months. And that's the problem with randomized clinical trials. With a randomized clinical trial, you've got to get someone who's agreeing to eat a certain way, and they're only going to do it for a certain time period. It has to be a permanent change in a lifestyle, the way you eat. So it's almost, if you begin to understand that it's not a diet, it's a changed lifestyle, you begin to understand the problems in saying we're going to do a randomized clinical trial for diet. Who's going to stay there for even 6 months? That's the problem when you start looking at randomized clinical trials. So the BMJ findings are consistent with the ADA's 2019 recommendation on carbs. Reducing overall carbohydrate intake for individuals with diabetes has demonstrated the most evidence for improving glycemia and may be applied in a variety of eating patterns that meet individual needs and preferences. Now that may sound like a little bit of weasel wording to you. It does to me, especially there at the end, and may be applied, but that's actually a huge improvement over where they were 2018 and before. ADA folks were saying carb it up. Yeah, a whole different set of battles, which I'm not going to get into because we've only got like an hour or so. Previously, the ADA warned against diets under 130 grams of carbs a day because people would be deprived of, quote, essential nutrients, end quote. So not going to make more comments in that space. So let's go back to this BMJ study. Low carb diet, how did they define it? I've asked that question a couple of times. They defined it as 26% of daily calories coming from carbs. Well, James, maybe you can be doing some of the math on a 16 to 1700 calorie diet. How many carbs would you have to do? How many grams of carbs? So I'm going to give you a few minutes to do that while I finish this part of the presentation. And then they had the very low carb diet. 10% of daily calories coming from carbs. And is that really like more of a keto kind of diet? And again, I can't help, when I'm asking questions and trying to sift out fact versus misunderstanding, there's really no definition of carbs here. And it reminds me of the conversation that I had with David Mines, who is in this same space, cardiovascular prevention, and he was a public speaker for like over 20 years. He was one of those as well. He talked about carbs, carb it up, the typical old style. Until about a couple of years ago, he and I were sitting in his car prior to a meeting. And he said, Ford, I have to tell you, it's so frustrating and embarrassing. I am a professional in dietetics. And for so many years, I've been telling people to eat carbs. So part of the confusion there was just 6 to 12 months prior to that conversation, he and I were in a debate at one of our meetings. I was on the low carb side. He was on the ADA side at that point. This was about 3 years ago. And I said something about decreasing carbs. And he said, are you telling me to decrease broccoli, to decrease cauliflower, to decrease asparagus? Because these are all high carb foods. They're made of nothing but carbs. So again, pardon me for the bunny hole, but we've got to be careful about what we're defining. No wonder we have so much argument as humans. We can't define things very well. So at the end of the day, I think we have to be more careful about saying low carb or glycemic. So participants were evaluated at 2 intervals at 6 and 12 months. The primary outcomes were type 2 diabetes remission. Well, speaking of definitions, what did that mean? For their study, it meant as a person who has previously been diagnosed with type 2 diabetes now has a hemoglobin A1C of less than 6.5%. Well, those of you who followed our channel know that there's a significant challenge in terms of comparing A1Cs between people. It's impacted by hemoglobin. Fasting glucose, less than 7 millimoles or 126 milligrams per deciliter, or with or without diabetes medication. So that's not the way I would define full-blown diabetes. Well, that's one of several ways. I wouldn't use the A1C. I would use the fasting glucose, but most often I use the peak glucose on an OGTT, oral glucose tolerance test. They also talked about weight loss, A1C, fasting glucose, and adverse events in terms of trying to define someone as, quote, in remission for type 2 diabetes. They also looked at secondary outcomes too, health-related quality of life, biochemical laboratory data. But as you see, where's the stuff about heart attack and stroke, which is one of the key things that we want to look at. At 6 months, the low-carb diets achieved a 32% diabetes remission, which is higher than the other diets. Remission was defined, as we said, A1C less than 6.5, fasting glucose less than 7 or 126. Smaller, non-significant effect occurred without diabetes medication. Additional benefits for the low-carb diet include large improvements in weight loss, significant weight loss. And I can tell you from doing this for a living, there is nothing like losing body fat to improve this situation. Pre-diabetes, diabetes, insulin resistance. You're usually going to get a significant decrease in triglycerides. And again, those are the 3 things that they're talking about. Large improvements in weight loss, triglycerides, and insulin sensitivity. So they may have been using some slightly different definitions, but we're all focusing on the same issue. Researchers acknowledge weight loss is the primary driver of remission. I do too. Again, I do this all day, every day, and weight loss is king. However, while low-carb groups lost more weight compared to the control groups, around 7.4 kilograms. So what is that, 15 pounds or more, 20 pounds? The weight difference as well as remission disappeared by 12 months. Remember what we talked about? These are clinical trials. In other words, you're randomized to, okay, for 6 months, I'm going to agree to this diet. They're not committed to making a change on their lifestyle. The decrease in benefits may have occurred because patients stopped sticking to the diet over time. Well, that's what we just said. More research, as most of these things do, they end up calling for more research to be done in exploring long-term adherence and effects. I will say this, in my own experience, I have a few folks who do very well on a ketogenic diet. More folks more often do better on a kinder, gentler, low-carb diet because it's just easier to stick to. This is not a sprint. Sprint lasts, 8 or 9 seconds. This is not even a marathon. Marathons last between 2 and 6 hours, depending on how fast or slow you are. This is month after month, year after year, decade after decade. So this is a permanent change that we have to look for. Also, very low-carb diets were less effective than low-carb diets for weight loss. However, this may have been explained by diet adherence. People on the very low-carb diets had more difficulty adhering to the very low-carb diet. The idea of diabetes remission is somewhat a new idea. I wouldn't say quite new, somewhat new. We don't have enough evidence yet that remission is permanent, so a lot of research is needed. I will say this, it's really clear that it's not permanent. The weight loss will decrease. There are a couple of things that impact the receptor, the insulin receptor. One is your age, another is your body fat. So if you lose body fat, you will improve your insulin resistance. I can't go further without mentioning one other little bunny hole. Once we get past age 65, we have to be very careful that it's not just losing weight, that it's losing body fat, because 65 and older is notorious for maintaining the same circumference, the same size of your leg, but muscle being replaced with fat. That is very dangerous, and that's one of the biggest causes of cardiovascular inflammation and insulin resistance. The amount of carbs people consumed on a low-carb diet varied, ranging from less than 26% to 45% of daily calories from carbs. That's not a low-carb diet to me, unless my math is wrong. That's a very, very gentle, very easy diet, unless it's including all of those broccoli, all of those fiber-related carbs. This could impact whether some low-carb diets work better than others. None of the studies control for protein intake. Many of the low-carb diets doubled the calories from protein, which could also have impacted the chance of remission. None of the studies controlled for medication use, making it difficult to really see the impact of low-carb diets alone. When beginning a low-carb diet, it's important to monitor blood sugar levels and to have the assistance of a doctor or registered dietitian who specializes in diabetes and nutrition. I would also say, when you talk to the dietitian, find out first if they're open and amenable to a low-carb diet. More and more are, especially over the past couple of years, dietitians like David, many of them have made that transition. Even the ADA has made that transition. So you're not seeing it so much anymore, but you still see it. Dietitians who say, and doctors who say low carb is bad.
Continue to get great feedback regarding the webinars, and here's why. On the internet, when you hear a webinar, you expect for somebody to try to sell you something. We're not doing that. We're trying to tell you something. People are coming in with their labs from Quest, inflammation panel, OGTT, insulin survey response, and then they're finding out, do I have inflammation? Do I have insulin resistance? And where does that fit in terms of other folks? We're getting ready to start one for CINT as well. So again, people are really excited about finding out their own status. Looking forward to seeing you there. Thanks.